Discuss about an important topic in biochemistry, that is enzyme inhibition. In this topic we will discuss about different types of enzyme inhibition and their important examples. For example, this enzyme inhibition, it is divided into two main types, that is reversible and irreversible. Okay, the enzyme inhibition, it is divided into two main types, that is reversible inhibition and irreversible inhibition. The reversible inhibition again divided into three types. The first one is the competitive inhibition, non-competitive inhibition and uncompetitive inhibition. While this irreversible inhibition, there is again one example of irreversible inhibition, that is suicide inhibition. Again we will discuss about what do you mean by feedback inhibition. Feedback inhibition. This is a important topic in enzyme. Also it covers lot of MCQ. There are number of MCQs on this topic, especially on the Km value, what happens to Km value and Vmax in various types of inhibition. And there is special short note on this topic, that is difference between competitive and non-competitive inhibition. Now let's discuss inhibition. Before going to discuss inhibition, we'll discuss what is inhibitor. Inhibitor, it is a substance or compound which decreases the velocity of reaction, that is known as enzyme inhibitor. Substance or compound which decreases the enzyme velocity. Okay. Now we'll discuss about the different types of inhibition, that is reversible and irreversible. The basic difference between reversible and irreversible inhibition is, in this reversible inhibition, the inhibitor binds to the substrate with non-covalent interactions. Non-covalent interactions. And this type of reactions can be reversed with the removal of inhibitor, or while increasing the substrate concentration, can reverse the reversible inhibition as the name suggests. There are various non-covalent interaction, for example van der Waals forces, electrostatic forces and etc. So this type of bonds can be this type of reaction can be reversed by increasing the substrate concentration or by removing the inhibitor from the active site of an enzyme. So this type of inhibition is known as reversible inhibition. While in irreversible inhibition, the inhibitor binds to the substrate with the help of covalent interactions, and they brings about the conformational change at the active site of an enzyme, and this conformational change destroyed the enzyme completely. That's why it is a irreversible inhibition. Now it is clear the difference between reversible and irreversible inhibition. In reversible inhibition, inhibitor binds to the substrate with the non-covalent interactions, that is weak forces, and in irreversible inhibition, the inhibitor binds to the substrate with the help of covalent bonds. So it is irreversible because of distortion of the active site of an enzyme. Now coming to the competitive inhibition, this is a very important, and there are various drugs which act by this mechanism, that is competitive inhibition. Now suppose this one is the enzyme. and this is the active site of an enzyme. This one is the enzyme molecule and this one is the active site of an enzyme. You know that active site is a pockets, crevices or cleft on a big enzyme molecule where substrate can bind. That is known as active site of an enzyme. And this one is the inhibitor. Suppose this one is the substrate. This is the substrate. And this one is the inhibitor. So what happens in competitive inhibition? This is the enzyme, this is active site. This active site of an enzyme is occupied by the inhibitor and substrate cannot bind to the active site of an enzyme. So it depends upon the two factors. First one is the concentration of that inhibitor or substrate, and second one is the affinity towards the enzyme. So these two factors are very important in competitive inhibition. Whose concentration is more, that will inhibit or that will get bind to the enzyme. For example, if the inhibitor concentration is more, the inhibitor will bind with the active site of an enzyme, and if the substrate concentration is more, substrate will bind with the enzyme. There is competition between these two because the inhibitor resembles the substrate, and the terminology is known as inhibitor is a substrate analog. Inhibitor is a substrate analog. That's why it's compete with the substrate for binding with active site of an enzyme. So the first important point in competitive inhibition is the inhibitor is substrate analog. Second, there is competition between substrate and inhibitor to bind with the active site of an enzyme. This type of inhibition can be overcome by increasing the substrate concentration. In this type of reaction, Km value increases and Vmax remain unchanged. So this is a important MCQ part. In the reaction, that is competitive inhibition, Km increases and Vmax remain unchanged. Remember, these are the most commonly asked MCQs in university exam, also in entrance. So Vmax is the maximum velocity. You cannot go above the maximum velocity. So Vmax in any type of inhibition, Vmax either it remain unchanged or it gets lowered. There is nothing like increase in the Vmax. Okay. And Km value, it is the Michaelis-Menten constant or Briggs and Holden's constant. It denotes the strength of association between enzyme and substrate. More is the Km value, less is the affinity towards the enzyme, less is the affinity of enzyme towards the substrate, and less is the Km value, more is the affinity of enzyme towards the substrate. So MCQ part is, in this competitive inhibition, Km value increases and Vmax remain unchanged. We'll plot a graph. Suppose this is a graph. This is x-axis. On x-axis there is substrate concentration and here is the enzyme velocity. Okay. Now if we plot a graph, this is a without inhibitor, the plot without inhibitor. This is with the inhibitor. So this is substrate concentration and enzyme velocity. This is without inhibitor and this one is a with inhibitor. This is the half of the Vmax. In the competitive inhibition, this Vmax remain unchanged, and this is the Km value, and this is the Km value with inhibitor. Now look in this graph, this Vmax remain unchanged and Km value increases with the help of inhibitor. You can draw a Lineweaver-Burke double reciprocal plot also. In this is a graph. This is 1 by substrate concentration. This is 1 by velocity. This is half of the maximum. So, if you plot a graph, the Vmax remain unchanged. This is a graph without inhibitor, and this is a graph with inhibitor. This value, that is Vmax, remain unchanged. This is the 1 by Vmax, and Km value increases with the help of inhibitor. So this is about competitive inhibition. Summarizing the competitive inhibition, inhibitors are the substrate analog. Then they compete for the active site of an enzyme. The competition is basically between the affinity and the concentration. The competitive inhibition can be overcome by increasing the substrate concentration. In this type of inhibition, Km value increases and Vmax remain unchanged. Now coming to the examples of competitive inhibition. The important examples are, the first one is the most commonly asked in MCQ is malonate, oxalate. This inhibitor inhibits succinate dehydrogenase. Inhibit the succinate dehydrogenase enzyme. Here the substrate is succinate. This one is the substrate, this one is the inhibitor, and this one is the enzyme. This one is the inhibitor. Malonate is the inhibitor. Succinate dehydrogenase is the enzyme, and succinate is the substrate. Second common example is allopurinol, which is a drug. It is used in the treatment of gout, that is typically involve the first metatarsophalangeal joint. There is intense pain due to the deposition of urate crystal in the joint. For the treatment, we use allopurinol, and it inhibits the xanthine oxidase. This one is the enzyme, and hypoxanthine and xanthine, these are the substrates. This is also an example of suicide inhibition, but here it is a example of competitive inhibition. Allopurinol inhibits the xanthine oxidase, and these are the substrate, hypoxanthine and xanthine. Then third important is ethanol. It is used in the alcohol, that is methanol poisoning. Inhibits the alcohol dehydrogenase. The substrate is methanol. Methanol poisoning, we use ethanol as a drug. Remember, ethanol is a food, it is a drug, and it is a poison depending upon the concentration. Okay, so these are the three examples, that is malonate, allopurinol, and ethanol. Some are anti-metabolite which are used in the cancer. This is also known as anti-metabolite, used in the treatment of the cancer. The common examples are methotrexate, and amithopterin. These are the drugs which inhibit dihydrofolate reductase and brings about the inhibition of cell division by blocking the purine synthesis. So these are the 4 important examples of competitive inhibition. Now let's talk about the non-competitive inhibition. What's happened? What will happen in the non-competitive inhibition? In non-competitive inhibition, this inhibitor competes. No, there is no competition or no resemblance with the substrate. The inhibitor structurally not similar to that of the substrate. Suppose this one is the inhibitor, and it get bind to the site other than the active site of an enzyme. So it get bind to this active site of an enzyme. The site other than the active site of an enzyme. This one is the inhibitor, and it causes the conformational change in the active site of an enzyme, and inhibitor cannot bind with the active site of an enzyme. This is a non-competitive inhibition. In non-competitive inhibition, the first point is there is no structural similarity or resemblance. The first point. Second, there is no competition between substrate and inhibitor. It get binds to the other site other than the active site of an enzyme, brings about the conformational change in the active site so that substrate cannot bind with the enzyme. In this type of inhibition, it get either bind to the enzyme to form a enzyme inhibitor complex, or it get bind with the enzyme substrate complex to form enzyme substrate inhibitor complex. This type of inhibition cannot be overcome by increasing the substrate concentration, because inhibitor binds to the enzyme and brings about the conformational change in the active site of an enzyme. In this type of reaction, Km value remain unchanged. This is MCQ part, and Vmax get lowered. So this is non-competitive inhibition. There is no structural similarity between substrate and inhibitor. There is no competition. The inhibitor binds to the other site other than the active site. It results in the formation of enzyme inhibitor complex or enzyme substrate inhibitor complex. Can't overcome by increasing substrate concentration. There is Km remain unchanged and Vmax get lowered in the non-competitive inhibition. Non-competitive inhibition. Okay. Now coming to the examples. The most important example in non-competitive inhibition is fluoride inhibit enolase. Enolase, it is a glycolytic enzyme. We use the fluoride bulb in the collection of sample for estimation of plasma glucose. The composition of fluoride bulb is sodium fluoride and potassium oxalate in the ratio of 1:3. This prevents the glycolysis, and this is a anticoagulant. This one is a anticoagulant. So how this prevents the glycolysis? By inhibit the enzyme enolase by non-competitive inhibition. Fluoride ion inhibits the enolase by non-competitive inhibition. There is a formation of fluoride, phosphorus and magnesium complex, and this complex get attached to the site other than the active site and brings about the conformational change in the active site of an enzyme and prevent the binding of substrate to the enzyme. So the glycolysis is prevented by this complex, and it is used to collect the bulb. It is used to collect the blood for estimation of blood glucose. If we do not collect a sample in a fluoride bulb for glucose estimation, the glucose level will drop down by 5 to 10 milligram per deciliter per hour if we do not collect a blood in a fluoride bulb. Okay, because of continuous glycolysis occurring in the RBC. So this is the important example. Other examples are lead, silver, mercury. These ions inhibits the serine proteases. Serine proteases. So this is the example of competitive inhibition. Now coming to the irreversible inhibition. In uncompetitive inhibition, before that we will discuss about uncompetitive inhibition. Remember only two things about the uncompetitive inhibition. In uncompetitive inhibition, the inhibitor binds with the enzyme substrate complex to form enzyme substrate inhibitor complex and brings about the decrease in the activity of enzyme. There is decrease in both Km value also decreases and Vmax also decreases. So this is all about uncompetitive inhibition. Now coming to irreversible inhibition. In irreversible inhibition, we already discussed that there is covalent binding of inhibitor to the enzyme molecule that brings about the distortion of active site and inactivate the enzyme. So this type of reaction cannot be reversed. That's why they are known as irreversible inhibition. The particular examples are, that is DFP. This one is the nerve gas. It is used by the German during the Second World War. DFP, and it inhibits the serine proteases, the enzyme which contains serine at the active site, their active site, and acetylcholinesterase. So this is the DFP. Is the antabuse, that is disulfiram, that inhibits the acetaldehyde dehydrogenase. This ethanol is converted into acetic acid. This ethanol is converted into acetaldehyde, and this acetaldehyde cannot be converted into acetic acid. So all the toxic effects are due to the accumulation of acetaldehyde. So this is a acetaldehyde dehydrogenase. This disulfiram inhibits this acetaldehyde dehydrogenase. There is accumulation of acetaldehyde, and all toxic effects are due to the acetaldehyde, that is vomiting, diarrhea, abdominal pain. And due to these symptoms, generally alcoholic do not consume alcohol because of this disulfiram. So it is antabuse, is used in the treatment of ethanol addiction. So these are the two important examples of. Now coming to the suicide inhibition, it is one of the type of irreversible inhibition. In suicide inhibition, what happens? The inhibitor itself converted into the more potent form by the enzyme which get inhibited. I will explain this with the help of one example, that is xanthine oxidase. This is the enzyme. This one is the inhibitor, that is allopurinol. What is the action of xanthine oxidase? Xanthine oxidase converts this allopurinol into alloxanthine, and this one is a more powerful inhibitor of xanthine oxidase than the allopurinol. So inhibition of xanthine oxidase with allopurinol, this is a competitive inhibition, and inhibition of xanthine oxidase with alloxanthine, this is suicide inhibition. Okay, means this enzyme causes conversion of allopurinol to alloxanthine. Alloxanthine is a more powerful and more potent inhibitor of xanthine oxidase than the allopurinol. That's why it is known as suicide inhibition. Enzyme itself causes conversion of allopurinol to alloxanthine. and this is the commonly prescribed drug in the treatment of gout. So it is very important in the treatment of gout. We use allopurinol as a drug. And coming to the feedback inhibition, in feedback inhibition, the final product of the pathway inhibits the first rate limiting step of the reaction. For example, in the heme synthesis, this is succinyl coenzyme A plus glycine. There is formation of del aminoleucinic acid with the help of ALA synthase. And through the various steps, there is formation of heme. Now this final product inhibits the first rate limiting enzyme, that is ALA synthase. This is known as feedback inhibition. And when it is at a genetic level, that is known as feedback regulation. When this inhibition at the genetic level, it causes feedback regulation. Example is dietary cholesterol synthesis, dietary cholesterol consumption. Dietary cholesterol consumption inhibits cholesterol synthesis. This is at the genetic level, that's why it is known as feedback regulation. This is all about inhibition. Keep watching. Thank you, all of you.